I want to honor all of our great participants, and I appreciate, the community um, reaching out and helping us as the Healthy Flint Research Coordinating Center, which is a collaborative between the Michigan State University, University of Michigan, and Ann Arbor and University of Michigan Flint, really to fulfilling our mission to ensure that much of the health work and research and things that are happening in and around Flint are for the benefit of the Flint community. I am Deborah Verholden. I am one of the original co-founders of the Healthy Flint Research Coordinating Center. My partner is Yvonne Lewis, who many of you know from her active community work and engagement. She is the moderator for these sessions. And because we are now fully in compliance with the stay home order, she is attempting to connect in right now and should be joining us soon. So I'm your temporary fill-in moderator until she is able to get her connection established. So these series of webinars are really designed to support and empower and give the Flint community an opportunity to chime in, get their questions answered, raise concerns or issues about what's happening at present and what's happening in the future. It is designed as an opportunity for you to get information. To that end, we've reached out to many of our partners and experts in these areas and are relying on and counting on them. And one of the things I personally love about the Flint community is I think many of the things that we've experienced would have taken a lot of places off the map. But instead, Flint thrives in the face of all that. And I think it really is rooted in our ability to come together and get our needs met. So to that end, we have a basic format. We're going to talk a bit about the public health around COVID-19. We're going to talk about the science and hear from the medical perspective from Dr. Susan Wolford, Dr. Jennifer Johnson, a C.S. Mott Endowed professor at Michigan State University, is going to speak to us a bit about the science. We're going to hear from some of the agencies. And our goal this week is really to open up and expand the time for Q&A. Did I hear my moderator join in?
Dr. Deborah,
All right. And I'm handing it over to you, Yvonne. I've set the stage.
Okay. For some reason, my video is stopped, but I am here. Thank you. And again, let me welcome you. We're going to move right forward. I just want to take a moment to remind you that if you are one of our panelists today, please be ready to answer any of the questions that may come up as the participants are sending them in. For participants, if you look down at the bottom of your screen, you'll see that Q&A button. Please send your questions in so that we can be sure to respond to your questions. So we have a full day, so we want to begin now with Dr. Deborah Verholden, and you've already heard her give some of her introduction, but she is also the Associate Dean for Public Health Integration at the and a Mott Endowed professor at Michigan State University right here in Flint. We'll also hear from Dr. Susan Wolford. She is also a co-director for the Healthy Flint Research Coordinating Center, representing the University of Michigan Ann Arbor Core. She is an associate professor at the Susan B. Meister Child Health Evaluation and Research Center. So Dr. Deborah, would you please get us started?
Yes, great. Thank you, Yvonne. I want to talk just for just a minute about the public health perspective. There's a lot that we already know, and I don't want to reiterate past information, and I do encourage our participants to share the previous webinars with people, because I'm finding in the community there's still sort of a lack of understanding about what good information is, what credible information is, and what people should really be doing to keep themselves protected. The things I wanted to highlight from the public health end is that we are now entering the height of the epidemic in Michigan. And being trained as an epidemiologist, it has been an interesting thing to explain to people. But when I say the height of the epidemic, this is a new disease. So we have cases for something that was not anticipated. So when I say we're entering the height, what we're seeing now is really the big bolus and increase in cases. And just a few factors that account for that is we now are getting geared up and we've increased our testing. And anytime you increase testing, you get an increase in confirmed cases. That is not, in a way, it's a bit of an artifact of the fact that we now are just improving our capacity to identify who is and who is not positive. And so what we're finding is that some existing cases who were not confirmed as well as new and emerging asymptomatic cases are now becoming confirmed cases. So some of the what we see with the increase in cases is an artifact of we now have better testing, and some of it is in fact a function of we've got great variability in adherence to public health protocols and recommendations. You know, people staying home, practicing social distancing, et cetera. So some of it is attributable to we've improved our capacity to actually identify true cases, and some of it is we have a lot of variability, and we've been a little bit hesitant as a nation and as a community to respond to the real public health recommendations. Something else that we now see is that disparities are emerging. Many of you, I believe, saw this article. If you haven't, what we're finding out now is that Black communities and some underserved and economically disadvantaged communities are being hit harder by coronavirus. Specifically, I'm highlighting what we're seeing now in Michigan. And if you've heard that this is something that's isolated to Detroit, that's actually not the case. So the link to this article is here. And again, I think we all want to count on the state Department of Health and Human Services, as well as our local health department and local leaders to be our credible sources of information. We must continue to do our work to flatten the curve. It's critically important that we do not overburden the health system during this period. We don't want our healthcare providers faced with tough choices about how to administer and utilize the very limited resources that we have that we know were insufficient to respond to this epidemic. We've got to give our healthcare system time, if you will, to catch up. So this flattening the curve is so important. And how are we going to do that? Again, adherence to the public health strategies that have been put forward are more important than ever. And I chose here to highlight the message that's being communicated by our State Department of Health and Human Services, which is to stay home, to stay safe, and to save lives. We're going to hear now from Dr. Susan Wolford, who I personally really enjoy being caught up with her each week about what we need to understand from the medical perspective. So I'm going to now hand it over to Dr. Wolford.
Thank you so much, Dr. Verhulden, and thank you for this opportunity to share from the clinical and medical perspective about how we can fight this COVID-19 pandemic. So the first thing, as has been mentioned, is to avoid coming in contact with the virus and to avoid spreading it, we need to stay at home. And if we have to go outside, of course, we're going to practice the social distancing. And then if we come inside and we think we may have been exposed, so if we are a healthcare provider or for some reason we think we may have been exposed, then we want to take off our outer garments and fetch as many of our garments as we possibly can. Washing them, drying them at a high temperature will help kill the virus. And of course, having a shower to get rid of anything that may have gotten onto us. But how do we fight COVID if it gets into the house? What do we do then? Well, we have to remember that there are those high touch surfaces such as key fobs and doorknobs that have viruses there, even though we can't see them. And so we need to clean and disinfect. And there are lots of substances that one can use, but bleach diluted as is described here is effective. Be careful to protect yourself and to use good ventilation, but not to forget soap. Soap is a great tool in fighting this virus because soap dissolves that outer layer of the virus and destroys it. So we mustn't forget that. And then, how do we fight COVID if it actually makes its way into our body? So we will remember that there are no currently FDA-approved treatments, but we are left with our immune system that can help us. And so I'd like to describe just a few of the ways in which our immune system helps us fight the virus. So the first way is with phagocytes, or a type of white blood cell. And these phagocytes, remember, it reminds us of a popular soda. In the same way we might consume that a phago drink, the phagocytes consume viruses and bacteria, other pathogens that make their way into the body. Along with having that work done by the phagocytes, we have antibodies. And the antibodies, if there's a virus or another pathogen in the body, we have B cells that create the antibodies. The antibodies connect to the virus, which draws phagocytes towards them and helps in that killing process. And the third one I would like to mention are natural killer cells. So these cells, if you remember, a healthy cell like we have here, can become infected by a virus. And as Dr. Deborah mentioned, we can look back at the older webinars to learn more about that. But what some of these clever healthy cells do is to take pieces of that virus and attach it to their surface. Well, when they do that, then that attracts these natural killer cells whose job is to destroy anything they come in contact with, and that helps us get rid of the virus and doesn't let it replicate and take over. So how can we help our body to have the best immune system possible? Well, the studies are, more studies are needed, but people often wonder about whether natural remedies will help. And I think it's important to note that there are no randomized controlled trials proving that natural remedies help to treat COVID-19. However, just as we've spoken before about some promising ideas for other medications, there are some promising ideas where it comes to natural remedies. One of these is N-acetylcysteine. Easier way to remember it is NAC. So NAC has been tried in a study of elderly people who had influenza A. And those who, some got a placebo, i.e. a medication with, or a fake medication, there's no actual active medication in it, and others got NAC. Those who got the fake medication, 79% of them got sick, whereas those who got NAC, only 25% of them got sick. So while this doesn't prove that it will help against COVID-19, it certainly is an area that warrants some investigation. There are some other things we can do, such as exercise. If we look at this graph of risk of getting a viral infection versus how much we exercise, if we engage in moderate exercise, about 30 minutes most day, you see the risk of getting a viral infection is quite low. That risk goes up if we're sedentary, sort of sitting around and not doing much. And then it also goes up if we engage in activity that's too intense. So moderate activity is recommended. Sleep also plays a role. The percentage in a particular study, the percentage who got a cold when exposed to a virus was twice as high in those with fewer hours of sleep, in this case 5 hours or less of sleep, compared to those who got 6 hours or more. So clearly these are things that all of us can do to help remain healthy. I want to mention stress. The relationship between stress and our immune system is very complex, but I think it is generally agreed that chronic stress impacts our ability, the ability of many of our cells, such as the natural killer cells and white cells that I mentioned. It impacts their ability to fight off infection. And so we should do our best to not to stay stressed. So bring into our lives those things that might help control stress. And I think we're going to hear more about that in a bit. And then we wonder, is there anything else? And it's interesting to note that from this, from the data that we have so far on COVID-19, it appears that it affects people more severely if they have chronic illnesses or if they have excess weight. So one thing that we can do that will improve our overall health and might help in this circumstance also is really to think about what we eat and to put into our bodies the healthiest things that we can. And here are a couple of guidelines that one can consider: decreasing the sugar in what we have and increasing the fiber. You might not remember these guidelines of having less than 9 grams of per serving of sugar or having more than 3 grams of fiber per serving. But one thing that you can remember that might help us in this fight and certainly will help us in our overall health is to just pack our diet with as many fruits and vegetables as we possibly can. And with that, I shall hand back over to our moderator.
Yes, Susan, thank you so much. This is real time, and so we're making some adjustments. We're going to move to our actual city of Flint. We understand that Dr. Lawrence Reynolds, who is the chief advisor, health advisor for the city of Flint, will have to move away for another important conference call. So we're going to switch some slides around and ask Dr. Reynolds to prepare. There is some updates that we want to hear from the city. He is representing the mayor's office, and so we definitely want to make sure we get that information. So Dr. Reynolds, are you ready? You give us a minute, we're going to get your slides up because we have to make these quick adjustments to our slide deck. But while we're doing that, I want to make sure all of you know that you can move right to those question and answer box, get those questions into us, and hopefully we'll get those questions answered for you today. Okay, thank you. Dr. Reynolds.
Thank you. I'd like to repeat the message that you can call for restoration of your water service at 810-410-2020. We realize, we all understand that personal hygiene and sanitation of your household is most important for all the reasons that have just been outlined. Now, stay at home is a challenge, especially if you get stir crazy. However, it's the most important element at this time that you stay at home, and if you must go out, practice social distancing. In other words, at least 6 feet apart from folks. Cover your coughs. Some people are wearing face masks. They're still working out the details on that on the national level, but it's worthy of consideration. Now, there are things that we overlook during these crises, and one is, COVID is out there, but we forget about all the other conditions we have or might acquire, be they contagious or just due to chronic disease. So always take your medications, make sure you have enough. And if you have diabetes, I can only reiterate what was just said. Follow your diet. While you're taking care of yourself at home, if you have a question, call your doctor, nurse practitioner, or clinic before you make any changes, and actually before you go to urgent care or the emergency room, because you might needlessly expose yourself or someone else may expose you to the virus, and that will only make our load heavier. So those are the things that we need to do during this time. Now, we do have a curfew, and we are really asking the citizens and residents of Flint to cooperate. And I made the mistake of saying citizens. Residents are our neighbors, and so we're asking the residents to cooperate. Don't go out unless you don't have to, but there's a curfew between 9 p.m. and 6 a.m. through May 1st. We've noticed that folks are gathering and not observing social distancing in some parks or in front of some beer and wine stores, and we really need your help because we don't want to carry the viral infection back to our families because we couldn't follow those requests. So if you can't consider yourself, consider all those you love. Thank you.
Thank you so much, Dr. Reynolds. We're going to just take another minute and ask if there are questions. We're looking at the questions. We don't see any, but we know, Dr. Reynolds, you only have a few more minutes, but I would like to ask you, there were some questions about the water shutoffs and restoring, and you spoke about that. But could you also give us some insights? Do you have any idea about how many people in our community might need their water restored and how community members might be reaching out to help get this word out?
What I would say is, number one, Never tell yourself no, or never tell your friend or neighbor no. If they have a question about getting their water restored, they should call the number 410-2020. That's the most important issue there. We have restored, actually, we have turned on water for new customers, but we don't know the number of people who have had their water shut off before the mayor took office in November. So we really are relying on people and their friends and neighbors to call. But let me be 100% clear. You must be an occupant of that household in order to get the service restored.
Thank you, Dr. Reynolds. I just noticed too here on the slide, which we will correct, it says the curfew is 9 p.m. to 6 p.m. That should be 9 p.m. to 6 a.m. Is that correct?
That is correct.
Awesome.
But if you want to stay in that long, that's fine too.
Dr. Reynolds, one more quick question for you. With the curfew, how is this going to be monitored? Because again, I got information the other day that all of our police force, everyone that was available in the city police department, they are now on the streets. And so what do people need to understand as consequences, or what will happen as a result of disobeying the curfew?
Well, the most important consequence is someone puts themselves at risk, their families at risk, and anybody else they come in contact with at risk. That is the most significant consequence. It is a misdemeanor. So in other words, someone can risk fine or detention. And that is absolutely something no one wants to do during a time like this. So we are really relying on the community to let their children, their grandchildren, their spouses, their in-laws, please observe the curfew. That's from 9 p.m. to 6 a.m.
Thank you, Dr. Reynolds. We have another question here for you. It's a question from Adam. He said, how are government and city officials in Flint ensuring equitable responses to COVID-19? We have some marginalized community members or populations in our community who are not able to fully social distance. This is quite challenging. And so what kind of, so that's part A. Let me let you ask that. And then there's a part B.
Okay. I think we covered the things that we should try to do in the home. To wipe surfaces, wash our hands, not cough in each other's faces. And I understand to some degree, social distancing is a privilege that some folks have and some folks don't have. But let me say, we as a community have dealt with these not having all the resources that we need, and we will struggle to make sure those resources are delivered to the city equitably. Yes.
Thank you, Doctor. Here's the other piece to that question. We have some undocumented members in our community, and there are great concerns. We've talked about this before. We really want to make sure all of our residents are taken care of. So how are we, or is there specific work being done by the city to address communications to the undocumented members of the communities and how they can get some relief in terms of the situation that we're experiencing?
Yes. Contact the Latinx Center. We have been working closely with them. We do have to rely on the state for translation services. So we have an outreach for the deaf and hard of hearing community. You will notice most of our communications, if not all on webcast, are signed. There are places where one can go for care. I understand the environment that has been created. Hamilton Family Health Network is open, and you do not have to produce documents of citizenship. You may just have to show your address or a utility bill. And once again, if you have a question, Don't tell yourself no. Call directly, and we'll see if we can get an answer. Hamilton can definitely provide those materials, and I'm sorry I don't have the phone number right in front of me, but that would be what I suggest. But we are very sensitive to how our residents, how our children's classmates, and how our family friends are treated.
Thank you, Dr. Reynolds. You know, we talked a little bit earlier about health disparities. Dr. Deborah Verholden mentioned that in her brief comments earlier. So we are really sensitive to the differences and the challenges that we're having with communication in our community. So we encourage you, if you, those of you that are listening, if you have family members or friends that you know need the support, there are resources available to them. Dr. Reynolds, one more question for you from one of our listeners, viewers. Should people be concerned about their water being shut off during this period for past due non-payment?
I'm so glad you asked that question. Mayor Neely, back on March 12th, made it clear there will be no shutoffs, but he was only repeating what he said when he took office. There have been no shutoffs since he took office, and there will be no shutoffs for the next 30 days at least. So we are restoring people's water service. It's very important to us that people get water, not just for sanitation, but for hydration as we deal with this infection.
Thank you, Dr. Reynolds. I just want to double back and say that last week we had Hamilton Community Health Network on, and their number is 810-406-4246. That again is 810-406-4246, and I'm sure they are available and ready to help out. Dr. Reynolds, I know you have to go, but can I ask you if you would just give us one more quick nugget from the city of Flint, from your perspective, for our listeners today?
Well, actually, I was hoping I could hear Dr. Johnson's presentation live, because self-care, watching our mood and emotions and how our feelings are affecting our behavior, is most important. And we must keep our wellness in mind. So I'll just repeat, if you're on medication, take your medication. If you need medication, call your provider to get more medication. And staying in communication with your family and providers is most essential. We cannot do this alone.
Thank you, Dr. Reynolds. You know, you have just provided for us such a wonderful segue, because we're going to double back now to Dr. Jennifer Johnson's presentation. But we certainly want to thank you for representing the city of Flint today. We were expecting the mayor, but obviously with what's going on, he was committed, but we recognized that he had to really attend to something at a national level, information that's going to be relevant for us here in our community. So we want to appreciate the work that the mayor is doing at this time on our behalf, and for you, Dr. Reynolds, sharing information today. So now we know from both presentations that managing our mental health and watching the stress levels is critically important to our health and well-being. So Dr. Jennifer Johnson, who has experience and is a trained in mental health area, will give us some insights on managing our stress at this time. Dr. Johnson.
Fantastic, thank you. I don't have the ability to advance the slides right now. Thank you. All right, so this is a quick review. You know, the things that help your health also help your ability to deal with stress. So these are all things we've talked about before. Take care of yourself, take a break from the news, keep a schedule, do things you enjoy, exercise. Next slide. So this isn't any different for our responders. You know, responding to COVID can take an emotional toll on anyone. Responders also need to take a break from media coverage, allow time for themselves and their family to recover, make time for personal self-care, and recognize that this can be stressful and that even supporters need support, and reach out if you feel overwhelmed. Okay, next slide. So unfortunately, we have families in Flint that are losing loved ones. I personally know of about 10 or 11 people who passed, not all in Flint, but mostly in Flint. And so we have families that are starting to deal with grief. And so, I wanted to do a little education on grief. People react differently to losing someone. Some people feel sad, some people feel angry, some feel numb, some feel lost, some feel okay. It's normal to have changes in sleep or appetite or feel tired. People have trouble concentrating. Some people want to be around people. Some people want to be alone. Some people just want to stay busy. Another thing to recognize about grief is that it comes in waves. In the morning, you can feel like you can't go on. You may have a couple good hours. It may come back, and that's normal. And so, if your family is grieving, it takes a physical toll. So rest, eat nutritious food, get a lot of sleep. This is a tax on your body. Talk about your sadness, listen to each other, but be tolerant of your grieving differences. There are going to be different people in your family that handle it differently, and that's okay. Just accept that and be kind to each other and know that it does get better. Next slide. Thank you. And so, you can do mindfulness in a very fast way. And so we're going to do 1 minute mindfulness here. Just as an example, you can go in your bathroom, go in your closet and do this. Okay, so inhale, exhale, inhale, and exhale, inhale, and exhale, and inhale, and exhale, and inhale, and exhale, and inhale, and exhale. And so, if you have time to go out in the sun, great, do that. But like I said, even if you have 1 minute, 5 minutes, go in the bathroom, go somewhere quiet, do some deep breathing. And this video actually had sound to it that didn't come over the web, but there are a lot of nice deep breathing and short relaxation activities on YouTube that you can look up. And that's my presentation for today.
Well, thank you, Jennifer. My goodness, I think I've calmed down a little bit. So this is really wonderful that we have this opportunity to get practical and intense information and education, but also provides us an opportunity to relax even in this process. So let me remind you again, please send those questions in. Let us know what your concerns are. I do have some additional questions that we'll be asking, but we do have some presentations from some of our community leaders. Excited today because we again have an update from our Genesee County Health Department, which will be followed by an update from the state. So Suzanne Kupel is going to be on with us now. Suzanne Kupel is the Public Health Division Director for the Genesee County Health Department. You'll note at the bottom of your screen, we put on some numbers from last week's call that were pertinent for you. So Suzanne, would you take over at this time?
Sure. So just a reminder to everyone that we are posting to our website the case counts each day at 2 p.m. We're being consistent with what the state of Michigan is doing. Also, the CDC is only posting to their website once a day. Things are happening too quickly for us to constantly post to the website. So our numbers are coming from 10 a.m. We will post again today at 2. As of yesterday, we had 337 cases that were positive and 10 deaths in Genesee County. I want to remind everyone that we have limited testing availability in our community. So the numbers that you see posted to our website may not be reflective of the community-wide transmission that is happening in our community. That is why we want you to stay at home. We want you to stay safe. We want to save lives. So practicing all the things that we've talked about and heard about today and that we've talked about previously are so important. We do want to stay home if we're sick. We want to do everything that we possibly can to prevent ourselves from getting the virus, but also passing it on to someone else. We do have a call center at the health department. That number is 810-257-3612, and you can press 9 to speak to somebody live in person if you have questions related to COVID-19. Also, our offices are closed, but that does not mean our staff are not working. So if you have a question or a concern, please don't hesitate to reach out. Again, the mainline health department number is the 810-257-3612 number, and we will address those concerns. Our Burton Clinic is still open, but we are practicing what we preach. We are doing social distancing. So many of our staff members are working from home. We are taking appointments only for Burton. So just want to make sure that you all know that you can still get a clinic service at our Burton location. You do need to make an appointment, and they will be screening. So if you are ill, we ask you to please stay at home. If there are any questions, I'll be happy to answer them.
Thank you, Suzanne. We are going to make sure we get questions answered in a little bit. We want to hear now from Brenda Jegede. I am so excited, Brenda, that you've been able to join us today. Brenda is the manager of the Office of Equity and Minority Health at the Michigan Department of Health and Human Services in the Policy and Planning Administration. They've been so busy at the state trying to get information prepared for us. So Brenda, please share with us the updates from the state at this time.
Thank you so much, Yvonne. And it is me who's very excited for having the invitation to participate in the webinar. It's really helpful for us to stay connected to how our local communities to COVID-19, to this pandemic, and we want to understand the challenges and continue to bring them back to our colleagues at the Michigan Department of Health and Human Services. So thank you. I just had a few updates to share. Our Office of Equity and Minority Health last month, we developed a list of items, things that we need to consider in terms of COVID-19 and our racial and ethnic minorities and marginalized communities. So there were some guiding, principles that we shared with our colleagues internally related to making sure we understand the greater risks that our racial and ethnic minorities have in terms of social and economic disadvantage, and also just historical issues of mistrust with our medical facilities at times, and also in just how we've responded to crisis and disaster preparedness, and making sure that we're thinking about how to best develop strategies and communication plans in partnerships with our community so that we're meeting their unique needs. So we shared these guiding principles and just a list of different things, including making sure we're collecting information by race and ethnicity, and that we're developing some methods to communicate with racial and ethnic minorities in addition to our online messaging. So those are strategies that we shared internally, and we've been happy to see that many of those things have been addressed in town halls that our administration has put on, but also in responses that our governor has had regarding some of the executive orders. I also wanted to mention that we have been working with our communications area and our public health administration, partnering with Brogan and Partners in the development of some PSAs, some radio ads and print ads, and we will be disseminating, and it has already started, some radio spots throughout the state but we've had some specific concentration in Southeast Michigan. And PSAs and the print messaging has been translated and disseminated in multiple languages, including making sure that we have translation for our deaf and hard of hearing communities. And in all of that translation, we've made sure there's a focus on our 5 racial and ethnic minority populations that we focus on, our African American, Native American, Arab and Chaldean, and Latinx community. But we also have a variety of translations in other languages, and we've made sure to connect with stakeholders to assure that the messages are being translated accurately. We're still working on that. Just received some feedback yesterday from Access on some of the translation. I wanted to mention that yesterday we did hold a community town hall. It was focused on reducing the impact of COVID-19 on our racial and ethnic communities. And we reinforced many of our health messages, but we also talked about testing and provided updates related to housing, transportation, and unemployment and education. And one of the messages that we are hearing today in terms of our emotional and mental health needs. And that was recorded, and it will be posted on our website, the recording, the slides, and responses to the questions that we received. And our website is michigan.gov/minority health. So we're working on that. And then I just wanted to mention that we recently heard from our colleagues in the Medical Services Administration that effective immediately, there's a, we will cover and waive the cost of COVID-19 related treatments for Medicare, Medicaid, and Marketplace members. And that telehealth services for members are in place as well. And in addition to expedite care and eliminate some of the burdens, the administrative burdens to providers, we are eliminating the need for providers to collect copays effective immediately. So those are some updates that we received from our Medical Services Administration. And additionally, they're looking at the Families First Coronavirus Response Act and looking to see what other things we'll be able to institute to provide free Medicaid coverage for testing and for uninsured residents. And then finally, just want to ask everyone to continue to go to our website. We have a website that has all the updated information, executive orders, resources, etc. There is also a hotline and an email response team where people can get answers to questions regarding COVID-19. And that hotline and email is being manned 7 days a week from 8 to 5. And that's my update, Yvonne.
Thank you so much, Brenda. We appreciate you. And I will acknowledge that you have been truly reaching out to the Flint community, Genesee County, as you've been working on your plans. And we certainly want you to know how much we appreciate that. So we'll continue to keep you in the loop as you help us to know what you're doing at the state level as well. Now we're gonna segue now to Dr. Tupper. Dr. Tupper is from Hurley Medical Center. He was with us on last week, and Dr. Tupper, I will tell you, we've got some really interesting calls. I think your presentation will help with some of those, but as soon as you're done with your update, we'll come right back and ask you a couple of these really emerging questions. So Dr. Tupper.
Once again, thank you. So if you wanted to advance to the next slide here. So I just wanted to provide some perspective on the spectrum of disease and the severity that we are seeing and has been described elsewhere. And this is some data. It's a Chinese data set. So whether this is extrapolated to all populations remains to be seen. I don't think you can take these as absolute numbers, but as general ballparks, they tend to mirror our experience. As far as what we're seeing, and the first question that we don't know is amongst patients. We don't know how many individuals are out there with COVID-19 that may be asymptomatic. We're hearing various things reported, but we don't have widespread testing yet. So the true disease burden in the population, we just don't have a great handle on. If there are individuals out there that have COVID-19 that are asymptomatic, that is both good news and bad news. The good news being is that those patients will essentially have no note of any illness and recover fully, and hopefully potentially have some degree of immunity to the virus. On the other hand, it's bad news in that it makes it more difficult to control the spread. And so that's why these stay-at-home orders are so important, even if you feel well, to minimize your contact, social distance, wash your hands, don't touch your face, etc., just to minimize the theoretical concern that there may be spread from asymptomatic carriers. Among patients that have symptoms that are testing, we're finding that anywhere from 70 to 80% have mild to moderate disease, where they may feel ill and feel very sick, but are able to be managed in an outpatient setting at home outside the hospital. On the other end of the spectrum, we're seeing anywhere from 20 to 30% that do require hospitalization, and of those, maybe a quarter to a third are critical. There is, obviously you see the mortality rates published. It's hard to really know what the true mortality rate of this disease is, simply because those are heavily influenced by how widespread the testing is. And countries that don't have widespread testing capabilities established are going to overestimate the disease burden simply because they're not testing the mild cases. So this is both reassuring, but the virus still needs to be taken very seriously because we don't know on an individual level what sort of spectrum of the disease you may fall into. We have certain predictors of patients that are likely to do worse or better, but there are no absolutes here. And as you've probably heard in news reports, there are occasionally young individuals without significant medical problems that are critically ill or having bad outcomes. And it's really impossible to predict. So it's really important that everyone take the necessary precautions to minimize the spread of this disease to the self and others. I also wanted to discuss some of the testing and treatment priorities. Currently, we still have some limitation with regards to our testing capabilities. And we're following guidance from the CDC and the Michigan Department of Health and Human Services with regards to who to prioritize the testing. And that's going to typically include patients that are severe enough to require hospitalization, healthcare workers and first responders, age greater than 65 and those with significant underlying health conditions, and also patients that reside in long-term facilities in order to minimize any community spread. When you come into the hospital with symptoms concerning for COVID-19, ultimately all patients coming to the hospital are triaged, and we always try to identify and see those that are sickest first. And those are followed by standard pathways related to age and underlying health conditions, symptoms that may be red flags, and also what their vital signs are. in making a determination with regards to hospitalization, it's really based on those factors. And in some select cases, we may rely on additional testing like labs and imaging to make determinations about who with COVID-19 or suspected COVID-19 requires hospitalizations. With regards to treatment, and I think I might have one more slide here potentially.
Yes, please, yes. No. Go back. Previous. That one right there. Yes. Thank you.
Okay. There is ultimately a lot of discussion has been with regards to ventilators. It's a minority of patients that are severely ill with COVID-19 that will require ventilators, but that is the resource that's many areas are concerned. If they have a large number of sick patients, it's a finite resource that could potentially be overwhelmed in certain areas. There was a question regarding home ventilators. That is not an option for COVID-19. It's a sophisticated machine that requires multiple providers trained in the operation. That really would not be an option for any home care, but most patients with COVID-19 thankfully will not get to the point. But I do think it's really important to have the discussions with your family and loved ones, especially if they're of advanced age or have significant other diseases like cancer, about what they would want in the situation that they got critically ill. And to have those difficult discussions, because there's many individuals that may say, if I'm unlikely to come off a ventilator, that may not be how I want to spend potentially my last few days. And so we're going to have those discussions with patients that appear critically ill, but it's really also important for family members and their loved ones to have those conversations beforehand so that these sort of things are thought about. Otherwise, the treatment is going to be supportive, including things like just oxygen will be enough for most patients that are hospitalized. We are ultimately pursuing a number of treatments for those that are hospitalized with severe disease. But as discussed earlier, all treatments for COVID-19 other than supportive care are not FDA approved and really fall in the category of experimental, meaning we don't know if they work or not. We have some preliminary data, but not established data.
Right. Thank you, Dr. Tupper. I do have one additional question for you. There's a question about people who are sick that have already been tested. They have not been told, they're not staying at home. What's the challenge here? What are people being told they should, once they get tested, even though they haven't gotten the results back, that they should quarantine?
Yes, patients that are tested for COVID-19 and pending the results should quarantine themselves and not go to work until the test results are available. So if you are being tested or if you have concerning symptoms, you should certainly stay home and self-quarantine.
So this is something that we could actually share with others and even encourage them, because I don't know if it's sometimes people are not really hearing when they're in these states and they're a little bit shocked and they want to keep going on with the activities of their daily life. But I think this is a place that we can all be helpful in saying it's not the right thing at this time. If you're ill again, stay at home and keep you safe and the rest of us as well. Any other comments on that, Dr. Tupper?
I agree. If you feel ill, and certainly if you have been tested for COVID-19, you should stay home and self-quarantine.
Thank you so much, Dr. Tupper. And we're just a couple minutes, we're about 4 minutes out from the end of our webinar today. We thank you so much for all that you presented. We're going to update real quickly. The Community Foundation of Greater Flint was on last week. Isaiah Oliver, the president. We just wanted to remind those of you that are listening that there is a Love Flint Fund that has been established. They will be distributing information about small grants that are available. Someone asked us a question about donations and where could those donations go. The Community Foundation of Greater Flint is accepting donations. If you would go to their website, you'll find all the information that you need there and how to contribute to that fund. We're going to just follow up a few more slides for information that we had. If we could just go to the next slide. We have some resources that are available. These are the panelists that are on the line now, waiting to respond to your questions directly. You can look at this list real quick if you have questions about the medical perspective. You've just heard the doctor and you've heard from Dr. Wolford. And so please send those questions in. We have representatives from the Genesee Health Plan, and certainly want to make sure you all know that if you need some health coverage, that's the place to call. We do have an update from the Mass Transit Authority as well that we want to provide for you. So we'll just continue moving through quickly so you can see the resources based upon the questions that were asked. We heard the conversation from the Michigan Department of Health and Human Services, Brenda Jegadet, and she told us what some of the resources were that they're providing. So here's an update on that, those websites. So if you need to go back and look at the webinar, you'll see this information there. In addition to that, we wanted to give you an update from the Greater Flint Health Coalition and the Flint Registry. They are still available to help. You can call. You see the number at the bottom of your screen, 232-2228. There is a representative from the registry on our panel. So if you have a quick question for them on how to get connected, please send that question to Afton right now. She's ready to answer your question. We also have an update from MTA. This is a very, very important update. MTA shared quickly with us last week that they had some service adjustments. And so here, effective April 2nd, which it was yesterday, the fixed route bus will be suspended until at least May 4th. They are apologizing for the inconvenience that this will cause, but due to the expansion of the virus, they feel it was necessary at this time to reduce these services. So MTA's Your Ride will continue to offer services for essential trips only. Essential trips only. If you have questions, please call 767-5541, 767-5541. The Mass Transit Authority really wants you to know they appreciate your support, and then they're doing their best to make sure that the services are available. We also want to remind you again that if you have questions about small businesses, there is information there, and that stay of evictions is still in place. Make sure you contact the state of Michigan for information about the eviction situation that you may be encountering, or you may know someone else that is as well. We have only a minute. There's a question about antibiotics, doctor. I hope that you can go on and respond to that question in the chat there, and we will make sure that you all are getting as much information as possible. So we will answer that question for you via line. So we're going to ask the panelists one more time to just stay on the line and answer any questions that you might have coming in from our panelists today. We want you to stay connected with us. You can reach us at look at our website at the hfrcc.org for more information, or you can go to the YouTube channel and follow up on and review this again. We are scheduled for next week. We have over 100 people that have already registered to be a part of our webinar for next week. So we want to invite you to join us again next week for the Flint Community Webinar on coronavirus. Thank you to our panelists, and for all of you that joined today, we want to say continue to be safe, stay in, be safe, be well, be healthy. God bless you all. Thank you.